Hi everyone, Joy here, and this unusually is going to be another video about me reading comments from videos, but this one's not going to be nearly as fun as the last one I made. It's strange that I'm doing this so soon after the last one, but I've been meaning to do this for a while and just needed some time to get all of the research materials and things together. So what happened was, I was watching a video with the title, Every Funny Blonde Moment in Game Show History. And this video was hosted on someone called Grimm's channel. And it was just, I've got my tablet here, it was just a, a collection of slides, game shows of people saying pretty dumb things and me laughing at them. Like, that's it. That's all I wanted to do. That's not what I ended up with. So I'm going to read the comments, and hopefully you'll understand by the time I get to the end of them why this is relevant. So I start. WTF was that last game show? How to incite infighting in the 70s between a man's wife and his secretary? How to cause a divorce? These were some seriously messed up relationships. Grimm's channel replied, that's exactly what I said. OMG, right? Someone else replied, that must be what reality TV was in the 1970s. Someone else replied, lol, I was thinking the same thing, like what the fuck kind of game show is that? Somebody else put, three's a crowd would be my guess. Right, now those comments would obviously, like, innocent enough and, related enough to the video to not make any sort of big deal out of it. This is where things start going wrong. Okay? So I'm calling out the people with the really shitty attitudes and, their usernames. So if you are a shitty person in this particular comment section, fuck yeah. I'm throwing you under the bus. Thailand Treats said, Jocelyn lgbtQ. Messed up then, you should see the messed up relationships now. Now a man can marry a woman, a few months later she is a he. A woman can marry a woman, a man can marry a man. Seems pretty normal back then compared to the circus nowadays. I replied, are you trying to piss me off? You must know what my username means and what I stand for, including gay, bi, trans, poly rights. There is nothing wrong with legitimizing gay marriage, polymarriage, or gender transition. Let me guess, you are the kind of person who is vehemently against these things even though they don't affect you. You don't want to get married to a partner of the same gender? Then don't. It's that simple. But your attitude is harmful to people who exist in society in relationships who aren't harming you. How is that fair or right? Whether a relationship is functional or not has everything to do with personality dynamics and nothing to do with what gender the people in it are. Grant Worley replied, and has since edited this reply, so I'm not sure which parts were edited. Jocelyn LGBTQ. Any relationship can be functional. The mental state of a transgender person isn't functional, however. It's crazy how we classify people who want to cut off their arm because they think that they would be more complete without it as mentally ill, but think otherwise with sex of a person. I think it's supposed to be imagine. Just imagine if we started telling the schizophrenic people the voices are real. By the way, Grant Worley, that's not the same thing at all. Guna.com replied, Jocelyn LGBTQ, I personally have no problem with gays, lesbians, or bi folk. Bloody hell, I wish I was bi. It might have broadened my horizons twofold. Wink. It's not that I'm okay with it. I truly am happy for anyone to do what they want with who they want, as long as it keeps them happy, and that overflows into the community around them. But what I find harmful and cannot accept as an educated, professional parent is a person demanding of another that they are to be addressed in 25 different genders, when clearly there are 2. And if a person who has had a sex change and overtly still looks like the sex they are trying to escape, insisting that we call them what they desire to be called, that's like me shooting an elephant and showing the game warden a permit to shoot deer. Oh no, officer, this is a deer. All its pachyderm qualities are gone. The gay fairy took them away. It's a deer. So why not stand for humans? I think you'll achieve a lot more. Of course, I have a wicked sense of humour and am winding you up too, but no insult meant. VTW, may I ask you a serious question? And this is not an insult, nor am I trying to be insulting in a cunningly disguised manner. See what else I did there? How come gay men, the majority in general, are in such high spirits and happy, and lesbian women so grumpy and miserable, on general? 2 of our dear family friends just got married, lesbians, and they are happy and awesome people, so when I say lesbian women, I'm talking of the majority. Thank you. I had some thoughts. This is not the place for this kind of topic, but whatever. Yeah, I actually wrote that. Grant Worley, trans people's mental states are fully functional. You are misinformed. Guna.com, what you've said is really problematic for a few reasons. Check my video on passing for some of the answers you seek. Firstly, no, you do not wish you were bi. It might sound convenient to you, but the truth is bi people arguably struggle the most with being visible and taken seriously within the LGBT+ community. Secondly, I know I'm not going to convince you of anything, but I find it patronising when people say there are 2 genders. You can't know that for certain, and there is validity to the multiple genders argument, all of which is far too lengthy to get into here. Thirdly, you've managed to highlight one of many problems for people who don't or can't pass, whether they want to or not. Their gender identity isn't seen as valid, despite any efforts they do to make, and that makes their lives worse when all you need to do is be respectful. You need to accept a person for what's on the inside, preconceptions be damned. I don't even know what you mean by stand up for humans, as if I already don't. Fourthly, I hope that question about gay guys and lesbians wasn't serious, because such sweeping generalizations are the basis for negative stereotypes and also just not true. Grant Worley replied, if trans mental states are fully functional, then why do they have the highest suicide rates pre- and post-surgery compared to everyone else? They need mental help, not someone telling them it's okay to mutilate their body. Maybe you need to do some research. I replied, research? Research only helps if you don't misrepresent the facts and statistics. Yes, it's true that trans people have high rates of suicide, but have you considered that it's because we're living in a largely uneducated and transphobic society? When trans people come out to their families, if they are supported, the suicide rate drops to that of everyone else. But there are more homeless teens that are LGBT+ than aren't, because they are treated badly by their families and, by extension, society. End of discussion. I want to add this little piece of information that I've found. LGBTQ plus adolescents that experience conversion therapy or rejections from their families and faith communities are 8 times more likely to attempt suicide than those from accepting environments. Now, this statistic backs up what I just said in that comment. And I will leave a link to the video where I got this from. Grant Worley again replied, "End of discussion. Tell me why WHO is still says cutting off your limbs is a mental health problem, but changing genders isn't. Also explain to me why over half the people who have gone through gender transformation wish they could reverse the surgery. One more thing, studying M2F suicide rates, most cases don't relate to not being accepted. It's more often due to regret of the surgery and the extreme pain from dilation that must be performed 5 times a day for the first couple's weeks, dropping to 2 to 5 times a week after a year. Not to mention every time the M2F would get the feeling of an erection, blood would flow out of the vagina," yes, he used fucking quotation marks, "increasing distress." Guess what? Here's my reply. Now, it's not true what you said. I found many articles, all from the same interview with the Telegraph, in the Telegraph, with the same surgeon, a Professor Miroslav Georgievich, a urologist and gender reassignment surgery specialist from Belgrade. Now, here's the sort of rough outline of that interview. The Professor Georgievich, who has seen an increase in reversal surgeries among transgender women who want their male genitalia back. In the past 5 years, Georgievich performed 7 reversals in his clinic in Belgrade. The urologist explains to the Telegraph that those who want the reversal display high levels of depression and in some instances suicidal thoughts. Other researchers also report hearing about such regrets. It can be a real disaster to hear those stories, Georgievich told the Telegraph. In Georgievich's practice, patients undergo a minimum of 1 to 2 years of psychiatric evaluation accompanied by hormonal evaluation and therapy. Prior to the surgery, he asks patients for 2 professional letters of recommendation. After the procedure, he strives to remain in contact. He talks with 80% of his former patients, the Telegraph reports. Now, I'm pretty sure that last paragraph was about gender reassignment surgeries, not reversal surgeries. But it was a little unclear. However, we also have a 2011 study found that after sex reassignment surgery, more than 300 Swedish transsexuals faced a higher risk for mortality, suicide ideation, and psychiatric issues compared to the rest of the population. The researchers concluded, our findings suggest that sex reassignment, although alleviating gender dysphoria, may not suffice as treatment for transsexualism, and should inspire improved psychiatric and somatic care after sex reassignment for this patient group. Now, I'm not going to say that, no, that's ridiculous. Of course, absolutely. Let's have more aftercare, psychiatric-wise, for people who undergo sex reassignment surgery, or any kind of surgery, really. Let's face it. But more than 300 transsexuals compared to the rest of the population tells us nothing. What I want to know is, what about the other people who went through that surgery and didn't face suicide ideation or mortality or psychiatric issues? And furthermore, what I do want to know about the ones that did face those issues is, did they have regrets? Were those issues based on regrets about having their surgeries, or was it something else? Again, this article does not say. finally, we have a little paragraph here saying gender reassignment surgeries are expensive. No fucking shock there. Male to female procedures cost between $7,000 and $24,000, and the cost of female to male procedures can reach $50,000. The complications and the expense warrant extra care from doctors performing these reassignments. Ethically, we have to help any person, says Georgievich, in the best possible way. And again, I'm not really going to argue with the overall message there of helping people. I found a commentary about that interview on a website called genderanalysis.net. So it says, transgender surgical reversal statistics, a clearer picture emerges. October 2017 saw a spate of fear-mongering articles alleging a rise in demand for surgical reversal of transgender genital surgeries. The Independent claimed that such reversal surgeries are more in demand than ever before. Well, what does this new demand look like? It's potentially why some of those seeking reversal surgeries are heading to a clinic in Serbia where Professor Miloslav Georgievich has been performing them for 5 years at the Belgrade Center for Genital Reconstructive Surgery. A specialist in genital reconstruction with 20 years of experience, Professor Georgievich began conducting the innovative procedures after a transgender patient who had undergone surgery to remove male genitalia requested a reversal. It's by no means a common practice. He has performed just 14 surgeries to date and is currently in the process of treating 2 reversal patients, reports the Daily Telegraph, explaining the procedure is extremely complex and can cost up to 18,000 euros. Now, let's just take a moment there. This professor, this surgeon, has been performing these types of surgeries for 5 years, and in that time he has had a total, including the ones currently at time of being written, 16 reversals in the space of 5 years. It's not a very large amount, is it? So, read the rest of this article. It says, presenting the data in this way is unhelpful. 16 post-operative trans people have sought surgical reversal, but out of how many? A naked numerator like this obscures understanding and encourages imaginative speculation that may not align with reality. Is it 16 out of 100 total trans people who've had genital surgery? This would be very concerning indeed, a 16% rate of surgical reversal. Is it 16 out of 10,000? This would be a rate of 0.16%, not exactly an epidemic. The problem is that most people aren't aware that there are millions of trans people in the world. 0.6% of the population being trans means about 44.6 million people around the world are trans. Fortunately, more useful statistics are now available on the practice of surgical reversal of transgenital surgeries. This month, WBUR Common Health reported on findings from a still unpublished study. The most recent data on transgender patients who changed their mind after surgery is a study led by Oregon Health and Science University, which has not been published but was presented at a conference earlier this month. In it, 46 surgeons from around the world reported reversing 36 transgender surgeries, including 16 phalloplasties, after treating somewhere between 18,000 and 27,000 patients. 36 surgical reversals out of 18 to 27,000 trans patients who've received surgery is a reversal rate of 0.13 to 0.2%. This is consistent with existing studies, finding that rates of regret following genital surgery of about 2%, and indicates that only a small fraction of those who do experience regret will go on to seek genital reversal surgery. I've been in touch with the study's authors, and while the study itself is not yet available, I look forward to continuing to cover this non-epidemic denominator and all. So it's looking far less likely that it's over 50% of trans people who have that much regret that they want to change their surgery results. This is what comes from actually doing one's research. So I found another article. It's not so much an article as a question on Quora, but it does relate to an article. The question is, what percentage of transgender people regret surgically completing transition? I read an article indicating the number was fairly significant. The response. I can tell you right now that fairly significant is meaningless, and therefore any claims including that is worthless. One person's fairly significant is another's barely registering. Vague and subjective claims are clear hallmarks of trolls and or of hostile agenda and or deceptive and manipulative intentions. Okay, now that's off my chest. The 2015 US Transgender Survey, really that survey ought to be prerequisite reading before asking any questions in transgender-related forums, of 27,715 non-cisgender respondents found the following on page 111. Respondents were asked whether they had ever detransitioned, which was defined as having gone back to living as their sex assigned at birth, at least for a while. 8% of respondents reported having detransitioned at some point. Most of those who detransitioned did so only temporarily. 62% of those who had detransitioned reported that they were currently living full-time in a gender different than the gender they were thought to be at birth. Transgender women were more likely to report having detransitioned, 11%, in contrast to transgender men, 4%. Rates of detransitioning also differed by race and ethnicity, with American Indian 14%, Asian 10%, and multiracial 10% respondents reporting the highest levels of detransitioning. Respondents who had detransitioned cited a range of reasons, though only 5% of those who had detransitioned reported that they had done so because they realised their gender transition was not for them, representing 0.4% of the overall sample. The most common reason cited for detransitioning was pressure from a parent, 36%. 26% reported that they detransitioned due to pressure from other family members, and 18% reported that they detransitioned because of pressure from their spouse or partner. Other common reasons included facing too much harassment or discrimination after they began transitioning, 31%, and having trouble getting a job, 29%. That answer came courtesy of Janet Garlick. I hope I can link all of this stuff to all of these sources in the description below. I just, really needed to spread the messages here in this actual research who, I was encouraged to do by Grant Worley and Guna.com. So there you have it. There's my response to you. There's the facts and evidence as is best available. Now, if you want to continue the conversation further, then fine, go ahead, be my guest. But let's keep it away from funny blonde moments on game show channels, because there's a time and a place to get political with one's gender. That's not it. Here's the time, here's the place. I'm ready now. Also, just one final thought, one final sort of clarification that I need to make, and that is that not all trans people have sex reassignment surgeries or go through with them. And to assume that they do is just factually incorrect, and to misrepresent that, even by omission, it does a disservice to not just trans people, but also to your own line of argument. Anyway, wish me luck editing all this stuff together, because I've had a few issues with camera and space and stuff. But that's it from me for now. See you soon. Take care. Bye.